I am very excited about the category longevity because by and large, it's getting people more motivated around their health. It's sort of giving health a consumer brand refresh. Now, where I get worried is social media is where a lot of these things are promoted. And, what does social media reward? It's engagement. What gets engagement? Extreme things.
It's not the consumer's job to have to spend hours looking at PubMed to try to figure out kind of what's legit and what's not.
Is it worthwhile to connect celebrities in Los Angeles to true real innovation? Not to say that others is not real innovation, but many of the actual longevity products both in development and currently on the market that truly work.
This is Second Opinions. I'm Christina Farr.
I'm Ash News.
And I'm Luba Greenwood.
Welcome to the pod, where each week we navigate what's really going on in healthcare through strikingly candid conversations with the entrepreneurs and investors leading the charge.
Thanks for joining us. Let's dive in.
Hi, everybody. Welcome back to Second Opinion. I am so excited about the topic that we have lined up today and about the guest. We have Georgina McMillan here from Headline. She's an investor who focuses on the intersection of consumer and health. And I brought her on because she and I actually met up last week to chat about some of the areas that she was investing in and the thematic work she was doing. And we got to chatting a little bit about the role of celebrity and the role of influencers in healthcare. And this is something that's been on my mind a lot, just as I've seen companies like Function Health take off, like Midi take off, backed by some really well-known celebrities who said, I care about health too. I'm experiencing everything from menopause to weight gain to some of the same things that we all experience. And now you see these celebrities starting to team up with healthcare companies for the first time. So I wanted to invite Georgina on, and by the way, she is based in LA, so the heart of the entertainment industry, to tell us a little bit more about why this whole trend is taking off. And joining us today also is my co-host, Luba Greenwood, who, as you know, is our biotech extraordinaire executive. And she is likewise so interested in this topic because in biotech, I think there's also a need to bring in more kind of celebrities and influencers into the field, especially given just all the misinformation out there. So excited to talk about that too. All right, so Georgina, I'm just going to kick things off by throwing a question over to you. So when you see these kind of like celebrity health startup kind of marriages coming together, is your first thought that, this startup is going to have some kind of a boost, that it's going to be a good thing? Or do you think it's kind of a mixed blessing?
Yeah, well, thank you so much for having me on. I'm a huge fan of the podcast, so very excited to be here. And great question. I mean, I think the first thing is there's definitely a distinction between celebrity doctors and like celebrities, like in entertainment and media and how we think of traditional celebrities. And there is definitely a convergence in both kinds getting involved in health, investing in health companies. And then there are also, like you mentioned, Function Health, the Mark Hymans, the Casey Means of the world, who are actually starting their own businesses, sometimes partnering with more traditional executives and bringing like their medical expertise. And so I see sort of two different worlds in that sense. But I think by and large, it gets me very excited because I think celebrities are a bit more consumer facing. And so much of the health experience today is very much not a consumer friendly experience. And I think anything that sort of motivates consumers to pay attention to their health and really care about it and focus on it is probably a good thing.
Yeah, you mentioned a few folks like Mark Hyman and others that I think, have become big names. What do you tend to see first? Like, do they become sort of very influential and then start the companies, or do they start the companies and through that process become influential?
I think it's sort of a combination of both. It's what's so interesting to me about this topic is it's sort of something that's happening in consumer overall, not just health, but to me, this is really a story about like distribution and distribution advantages. And, in the last few years, one of the reasons that early stage consumers actually been quite tough to invest in is because traditional channels of acquisition don't really work as well anymore. And so this is why we're seeing so many more celebrity brands pop up. But in terms of the question of the doctors and their influence, being here in LA, there definitely is a culture of celebrity doctors, especially celebrity plastic surgeons. And one of my good friends is a doctor, and over COVID started posting on social media and got a following just sharing tips around COVID, and then grew his practice, grew his business, started doing, IVs as well as like traditional medicine, and just saw explosive success from that. And I really think whether or not you're actually selling a product or you're selling a service, social media is really how people bring customers through the door. And so if you can create a distribution advantage and make yourself this figure of authority, I think, that's probably a good way to run a business.
Yeah, and I'll ask you one last question, then I'll throw it over to Luba. But when you're looking at these consumer businesses as a VC, and let's just kind of get a little bit in the weeds for a second, we do know that these paid marketing channels, whether it be, Facebook or other ways in which you can build your user base through literally paying for ads to reach your customers, we know that the costs are just going up and up and up. And investors don't like that, generally speaking, because it means that they're giving you money and that money is going straight to this customer acquisition through, essentially just paying Facebook to build your user base. So I wonder if the kind of celebrity thing is partly a reaction to that, because these folks, maybe they're on the cap table, they have equity, or they're sort of ambassadors of the business, and maybe they feel that authentic connection to the company. And I personally love it when I see that somebody's come into, I mentioned Midi, like come and gotten involved because they care about the topic of menopause. Maybe they've gone through menopause themselves. And I see that kind of authentic connection working well. But I wonder if it's for investors, is this seen as a potential solution to this problem of growing customer acquisition cost when you've already got a celebrity around the table who has an inbuilt audience of millions of followers? And think about how expensive that would be to build that through paid marketing channels.
Yeah. I mean, great question. This is really like the crux of what we think about a lot. And one of the biggest things we look for in companies is some sort of distribution advantage. Celebrity and these followings, they're great, especially in consumer businesses. I would say it's definitely not the end all be all in terms of how we look at it, because there still really has to be a through line of authenticity. There still has to be this feeling of trust, and there's still a good amount of key man risk with that. But I would say definitely, yes, it is a massive advantage. It's why you're seeing more and more of these. And in health, in something personal, I think it makes a big difference with people who are really trusted, like doctors. I think on the flip side, there's probably a danger to that a little bit, because it's hard to verify credentials, and there may be other motivators in terms of like money and brand sponsorships. But I think by and large, it's a very, very unique distribution advantage that gets us very excited about businesses across consumer, not just health.
Okay. So, Georgina, I love what you just said about, well, first of all, how you were thinking about this strategically, but also the potential, I wouldn't call it, as you said, potential challenges with having somebody that is potentially uncredentialed, or it is hard to find kind of the background of the person that is pushing some of these products. We're talking about health. We're also talking about consumer, and of course, consumer, you can really say pretty much anything you want. The whole point is that you're enjoying the product, you're loving the product. So I think, and people should invest in things that people are enjoying, and even mentally, they're thinking it's helping. So if you're thinking that eating a lot of broccoli is going to be very healthy, you should eat a lot of broccoli, and somebody should teach you how to cook it and sell a cookbook or broccoli juice or celery juice. So I think that's fantastic. So
there's probably a broccoli influencer out there somewhere.
There's everything, seriously.
I absolutely love it. I'm all for it. Where I'm a little bit worried and beginning more and more worried about now is longevity. And so people are now putting everything into longevity, including Georgina, you just mentioned, IV fluids. Okay, that's great. By the way, IV fluids, if you're thinking about equity, you are taking away right now. There's a shortage of IV fluids for people that really, really, truly need it. So just something to be aware of if you are going for an infusion after, a long night of drinking, maybe hold off for a few months. But when people talk about longevity, and I've now seen so many different companies opened up around it, med spas or people pushing products, including everything from regimens of what you eat, how you eat, to vitamins, to other such things. And a lot of them are promoted by celebrities, which is really wonderful. Where it becomes a little dangerous or a little concerning is when these things are pushed by physicians, but there is no clinical evidence. So if you are a doctor, and also if you are trained as plastic surgeon, you're not an endocrinologist, you're not primary care, you're not a GI, you're certainly not an oncologist. I think there is a really number one Netflix show right now about
to mention apple cider vinegar, right to the point. Yeah.
Close to this point, right?
Okay, but guys, as somebody who's not watching a lot of TV right now, because I have too many small children, can somebody explain what this show is about?
Yes, so the show is about this woman. I believe her name is Belle. I've only seen the first episode, so just warning on that. But she basically fakes having a life-threatening brain tumor and then starts building an audience around how she cured herself through food as medicine, nutrition, alternative medicine, and wellness.
And this is a documentary.
This is a fiction show.
Okay, but it sounds like it could be a documentary.
It is loosely based on a true story, and she creates a wellness empire around her protocols and her practices, and ultimately all of it sort of ends up being a lie.
So that's a good segue to, I think, where Luva's going, which is like, how do you make sure that it's not a bunch of like charlatans? And that can include some of these doctors that, people see MD and they're like, oh, you're legit. But then, as Luva pointed out, there's different specialties of medicine.
Yeah. And can I also say, again, I have nothing against on the consumer side, or if you want to have a med spa and you want to have something, you can claim that massage, and there's some evidence massage is helping. You can claim that aromatherapy is helping, or lovely juices that are helping. That is okay. I think from especially investment standpoint of view, and ultimately who is the user? Is it a consumer? Is it a patient? I think there needs to be a little more education in this field for, I would say, end users. So again, especially patients, but also for investors. And this is where a lot of firms, investment firms now come to me and they ask me, is this a real thing? And if I invest in this chamber where you put a person in and you pump oxygen into them, by the way, oxygenation also causes cancer, but, just as an FYI, or you put probably, cryotherapy and you freeze a person, is that going to extend your life and make you younger biologically? There is a difference between, again, doing something because you're enjoying it or mentally you think that this is part of your routine of being healthy, and there's nothing wrong with that. You can also go to the gym and other such things, and that's more from the consumer standpoint. But I would like to, and I think there needs to be more separation between longevity, true longevity, and evidence-based and evidence-backed longevity products and services that are out there versus, nice to have really cool consumer things, which are also fun.
Couldn't agree with you more. I mean, I think that's why, like, Chrissy and I met is we want to be working with people like you both who spend a lot of time in this space. And, I think a lot of what I see in longevity, I am very excited about the category because by and large, it's getting people more motivated around their health. It's sort of giving health a consumer brand refresh. And of course, then there's the dangers that come with that. And I think a lot of longevity is a really, really brilliant marketing gimmick. I think your biological age and all these things, like, is there science to back that? I'm not a doctor. I'm not the best person to speak to that. But I think things that get consumers excited to make good health decisions, for me, are a net positive. Now, where I get worried is social media is where a lot of these things are promoted. And, what does social media reward? It's engagement. And what gets engagement? Extreme things. And that isn't always positive. And so to the point, I think there's a lot of influencer culture that tends to skew on that side of extreme. And I think that can be dangerous. We need to have more education and be able to have better protocols around flagging misinformation. I mean, that's a whole other topic right now when it comes to social media, particularly Meta and Instagram. But that's how I think about it right now.
Hey everyone, we'll get right back to the conversation after a word from our sponsors.
This show is sponsored by Midi Health. There are certain things that come with age: wisdom, experience, and knowledge, to name just a few. But if you're a woman over 40, it can also bring some less desirable things: hot flashes, insomnia, brain fog, moodiness, and weight gain, all symptoms of menopause and perimenopause. Yes, hormonal transition is a fact of life, but that doesn't mean you should have to accept its symptoms as just another part of aging. The experts at Midi Health understand what you're going through and know how to help. Midi Health is the only virtual care clinic for women navigating midlife hormonal transition. They support you with safe, effective, FDA-approved medications, as well as supplements, lifestyle coaching, and preventative health guidance. What's more, all their services are covered by insurance, and they're conveniently accessible through telehealth visits and 24/7 messaging. If you're over 40, use all that wisdom you've gained over the years and visit Midi Health. You deserve to feel great. Book your virtual visit today at joinmidi.com. That's joinmidi.com.
You're in Los Angeles, which is very exciting. I actually co-founded a company in LA. It was a lot of fun. And you're absolutely right. Every time you start anything in healthcare, it could be biotech, it could be health tech or consumer, you can at least get one celebrity to get excited about your product, which is great. Have you thought about connecting, and is it worthwhile to connect celebrities in Los Angeles to true real innovation? Not to say that others is not real innovation, but I really highly doubt that a plastic surgeon is the authority on many of the actual longevity products both in development and currently on the market that truly work. What are your thoughts about actually connecting some of these celebrities to real science up here in Boston or New York, where Chrissy is?
Luba, I've been wanting to do this for, I'm just going to say, years. I've been trying to find people that want to team up with me to do a summit in LA where you can invite kind of influencers and they can almost sort of do a matchmaking thing with some of these really interesting companies that would love to have them around the table. And then, somebody in some group in the middle, like an advisory group that just ensures that there is clinical evidence. But then also there's a plastic surgeon could be a great connection for a certain kind of business, right? Just because you're in cosmetic surgery doesn't mean that you shouldn't be.
Okay, well, we should all work on this. I want to collab. You guys have a marketplace model on your hands. I love the idea of a summit. I completely agree. I think it depends a little bit what stage do you bring the celebrity in? How far in development? Is it oh, we have this product and sort of it's all ready to go. And so things will sort of get pushed along because, they want to get things out to market. And then the celebrity sort of plopped in place to be the promotional engine. So I do think that these brands and these celebrities should be aware and really, really working with researchers and people who deeply understand the science. And I think it's funny, in skincare brands, I don't know if you've noticed this, but it seems like a lot of the newer brands that are really taking off right now, we've looked at a few of them and they're all sort of taking this biotech angle. And it's science backed. It's not just oh, dermatologists approved this product. 9 out of 10, women said it improved their skin. No, it's deeply on a, molecular level. Here's what it does. And whether or not that's true, I think that's the exact right question to be answering. And I think a lot of these researchers are really they should be more looped into the early stages of the brand creation, not just to validate it after the fact, I think. And I guess to the point of the plastic surgeons and being in LA, Chrissy and I spoke about this a little bit, and this is not direct true health, but one of the themes that gets me so excited right now is vanity and aesthetics and med spas. And for me, I actually think vanity is a great way to get motivation. To look good is usually you have to eat well and take care of your skin. And yes, you can do these other procedures to enhance things, but I think vanity is a great motivator that gets people excited about taking care of themselves.
I actually think for men, it's a very good motivator for men in particular, because men are like very bad at going to the doctor, as we know, that's been studied, but they are vain. Well, men are vain, they want to have muscles, they want to look good, they want to look young. And I'm seeing this, we talked about this, the male beauty craze that we're seeing right now. It's absolutely taking off. And I think you're right that there is something to that, like if you tell someone like go be healthy because it reduces your risk of cardiovascular disease in 20 years, they're like, no thanks. But if you say, go be healthy because you'll look good and your skin will be glowing and you can get more dates, I think that just kind of changes things for people.
I don't think humans are that good at thinking long term. Like we push things out, but if there's something like very raw and primal almost and connected to, yeah, the way we look, our ability to find a mate, I think those are very deep motivators and again can be used for good or bad. But I think longevity is it's also sort of a raw primal fear. Everyone's scared of dying, but you don't want to think about all the little steps that help you get there. You're just like, oh, well, I want to be biologically younger and younger and younger. And it's like this gamification sort of thing.
That as long as you die with no wrinkles, it's okay.
Die with no, I love that. Die with no wrinkles. That's going to be a tagline for some brand.
Speaking about Georgina, I love that you talk about vanity. And this is another area where things are shifting. And I'm glad they're shifting because at some point also influencers set the tone for what is beautiful. And so what I am loving right now is that out of Los Angeles, it seems like what's coming out right now is what's beauty. It's no longer the fillers in your face and fillers in your lips and kind of more of that fake, I would say, look. It's now more natural. So, and what's nice about the more natural look, the way to get you there is going to science. So right now you have a lot in Korea. I talk on this program a lot about Korea. They really are about 5 to 10 years ahead of on the scientific level to make your skin rejuvenate truly at a cellular level. And so that's something that, for example, I understand a lot of right now in LA, a lot of surgeons are going to Korea to bring some of those devices into the US. By the way, many of them are not approved by the FDA yet, but there is now interest in how do you keep, instead of injecting something in your face, Botox is still great, but injecting things into your face that make it look like fake collagen, how do you actually make your own? And so there are a lot of technology, truly real science that can help you get there. And so I'm really glad that right now influencers are embracing using more real science, real technology to replenish your own cells versus just using fake fillers.
I love that. And I think that's really positive to see more real science come to the fore. But then the thing I wanted to ask about too was, have you guys noticed this trend on Instagram where like everybody just kind of looks the same? Like there was a viral
Instagram face.
reel. Yes, Instagram face. There was some viral reel where they showed celebrities from like the 90s and 2000s, people like Sarah Jessica Parker in her prime, and they looked really different, and now it seems like everybody's got the same look, and it's the fillers and the like cosmetic surgery and the like all the stuff that people just seem to be doing to achieve this look. So, what are your thoughts, Regina, on this like problem of just like, are we spending all these resources and having everybody just kind of look the same?
Well, I agree. I'm seeing a lot of that. I think the tone even in LA around fillers is shifting. People are definitely scared of fillers migrating, and I've been hearing a lot of that.
Oh, that's interesting.
I've noticed less and less people getting fillers and seeing sort of like other things. But in terms of the sort of everyone looking the same, I think that's probably a function of social media and the way that we look at celebrities, the way that we idolize celebrities, our algorithms sort of putting us in these echo chambers. Again, like I'm definitely not the expert on that. I think what is interesting is, and this kind of goes back to your point about like IV fluids and doctors. there's a lot of money to be made in all of this. And so I think a lot of nurses are getting pulled into, they'll make more money if they're going to be, estheticians and aesthetic practitioners. And it is actually taking resources away from like people that need it in hospitals. And I think this is actually happening in Korea, but I was reading about it, and it's an interesting phenomenon. So when you talk about the resources, I do think that there's so much money to be made, and it kind of goes back to the point of like, how do we get the consumer to really, really want to focus on their health, but also, there's this beauty aspect that is really, really motivating and people are willing to spend so much money on.
Well, I feel like the sort of overarching point of a lot of this discussion that we've been having is that there is this very natural human drive towards aesthetics and wanting to look good, and that can be parlayed into even a public health agenda to some extent. Could you get people thinking more about longevity and preventing heart disease and cancer because of the steps that they're taking, and can influencers play a role in that? And I think that's all good. And then I think we've also clearly articulated many of the downsides, which is just all the resources now going into this first wave. And I think this is a first wave that we're seeing right now, which is much more, like you all said, aesthetics driven, and sometimes far less concerned with science and evidence, and much more concerned with pushing of products and services. And I think you see that in just the continued explosion of the supplements industry and the Botox and the fillers and all these things that we've been discussing. So this is definitely a topic that I want to keep chatting about on the podcast.
Yeah, I have a question. So, we talk about what we want and what we like. What motivates celebrities, A-list stars? What motivates them to partner with either consumer or life science brands? I can assure you that what motivates, especially people in Boston, by the way, where many celebrities are from, we're all pretty nerdy here in Boston. We actually really care about coming up with the most amazing new science and scientific application, be it for aesthetics, be it for cancer, whatever it is. But we are so obsessed with science that we just want to make something that's cutting edge and people will like. So what is the motivation of celebrities? Why would they get involved in things like this?
I'm not sure I'm the best person to answer like what their motivation is, although I do think that's exactly the right question to be asking. My guess is it's dependent on the person. I have to imagine that there are a lot of celebrities that truly are really excited about these products and want to be involved. I'm sure there's also, agents pushing them because it looks good reputationally, or other motivations, money maybe being one of them. But again, that's the right question to ask. Why does a doctor decide to become an influencer, put themselves out there on social media? These are all things that the consumer should be questioning. And is it the consumer's job to question that? Or should there be better systems in place, better credentials, easier ways to have that trust? I don't know if that's feasible, but it is the right question to be asking. And I know that we focused a lot on vanity. And I think it excites me because it opens up, it's sort of like a sexier way to open up a conversation more about actual health. Although I know that like the vast majority of the country is probably not focused on, their Botox and fillers and has all this time to be like educating themselves on supplements. I don't think that's like a mass America thing yet. I think this is like a fringe health thing. And even longevity probably by and large is. But I do think if you look at like the Netflix documentary and you look at not just like even the Huberman Labs and Peter Attia's of the world, like the conversation around longevity and health is entering the mainstream a little bit more. Like I feel like Rogan talks about it, and if it's on Netflix, and so that does excite me for the message it could have to sort of a broader audience.
Celebrities are also humans, right, Georgina? So like they have issues with infertility. They are going through menopause. They have autoimmune disease. There are celebrities and influencers that are going through cancer diagnoses in real time. To just share a positive example, Olivia Munn, when she posted how she got diagnosed with breast cancer on Instagram and how she didn't have a family history and the way in which she essentially had to do additional kind of screenings to even find it, and how she worked with her oncologist. I think that got literally overnight thousands of women thinking about breast cancer and wanting to talk to their doctor about it. It was one of the most positive things I've seen for public health in a long time. And she didn't do that. I mean, I would be shocked if there was any money trading hands. I think she did that entirely because she wanted to educate women. And so it's like you say, Georgina, it's like it's a mixed bag, and there's authenticity tends to breed the best results when it's connected to something deep and personal. But they're not always, I get the sense that sometimes these folks are not necessarily being connected with the right individuals and teams and products and services that can solve the problem. And instead, they're sort of feeling what we're feeling, but recommending the wrong things. And like you said, it's not the consumer's job to have to spend hours looking at PubMed to try to figure out kind of what's legit and what's not. And so that there should be a higher burden on both the platforms and the creators, to do that work for us.
Yeah, I completely agree. I think where the power of celebrity can really help here, I'll share a story. My mom was diagnosed with a very rare cancer 7 years ago, and we learned 2 years ago that it metastasized, and there's, no cures for this. It's I think there's like 2,000 patients in the US that have it. And through the process of learning about that and going through like the hurdles of the health system and clinical trials, and obviously wanting to try and find a solution for her, I've asked, many oncologists, what does it take to like motivate, people to create a cure here? Obviously it's not that big of a market. And so you have to sort of create incentives that are not always financial. And one of the oncologists was like, what the best thing that could happen is a celebrity gets this cancer and posts about it. Like that is literally the best thing that could happen for these sort of rare cancers. And again, that's a specific example, but it goes to show like the power of these platforms. To your point, it's important that they be used for good, and these celebrities and these people with influence get connected to really like science-backed products and platforms, and are working with the right people and communicate that message the right way.
Thank you, ladies. We are at time, and I just have loved this discussion. And I agree that influencers and celebrities can be the right patient influencers, and in many ways a very powerful form of patient influencer or advocate. We just need to find the right things to connect them to. And Georgina, thanks so much for coming. Thanks for sharing your story about your mom. We'd love to have you come back whenever you want to, because
I would love to. Thank you for having me.
We need to keep this dialogue going. And if you're listening, we'd love to hear from you as well, just what you think the role of celebrity and influencer should be in health, and where have you seen it work and not work? Let us know. And we'll like we said, we'll keep talking. And thanks to both of you. Thanks, Luba, and thanks, Georgina.
Thank you. Thanks so much.
Thank you both so much. Bye.
Thanks for tuning in to Second Opinion. Share it with colleagues and friends, and message us to let us know what topics you want to discuss on the podcast. If you want to support the show, the best ways are to leave a review wherever you're listening and make sure you are subscribed. And check out Christina's Second Opinion newsletter on Beehive. A link to subscribe is in the episode description. Second Opinion is part of Turpentine, the podcast network behind Turpentine VC, Age of Miracles, and more shows for experts by experts in tech.
Hey everyone, Erik here. At Turpentine, we're building the first media outlet for tech people by tech people. We're the network behind the show you're listening to right now. We have a slate of hit shows across a range of topics and industries, from our AI and investing cluster of podcasts to shows that drive the conversation in tech with the most interesting thinkers, founders, investors, and influencers, like Econ 102 with Noah Smith. We're launching new shows every week, and we're looking for industry-leading sponsors. If you think that might be you and your company, email me at ericaturpentine.co. That's ERIK at turpentine.co, and let's partner together.